Hello everybody, I'm Dr. Hayat. I'm the orthopedic surgeon from Bone and Joint Hospital. I'm thankful to the Delhi Public School Administration who have invited me to deliver a lecture on the cardiopulmonary resuscitation. So far as the definition of the cardiopulmonary resuscitation is concerned, it is a technique of basic life support for oxygenating the brain and heart until appropriate definitive medical treatment can restore normal heart and ventricular function. So aim is to provide the basic life support till medical and advanced life support arrives. So purpose is to maintain an open airway, to maintain breathing by external ventilation, and to maintain blood circulation by external cardiac massage. So please remember these three steps. One is to maintain the airways. Second is to maintain the breathing by external ventilation. And C, that is the blood circulation. These A, B and C will determine our whole of the procedure. A is airways, B is the breathing, and C is the circulation. So these three should synchronize: airway, then breathing, and then the circulation. And our procedure will become simple and easy. So indications of this procedure is anything which stops the heart from functioning or which stops the lungs from functioning. In the cardiac, which we say that cardiac arrest, there are so many causes which I am not going to describe, and the respiratory causes which cause the respiratory arrest, like drowning, stroke, smoke inhalation, or the drug overuse. Most of the times we are concerned with the smoke inhalation in our setup. The principles of CPR are to restore an effective circulation and ventilation, to prevent irreversible cerebral damage due to anoxia. When the heart fails to maintain the cerebral circulation for 4 minutes, brain may suffer an irreversible damage. So it is the role of the rescuer or we people at that time to intervene during these 4 initial minutes. We cannot treat the patient on the roadside, but definitely we can prevent the irreversible brain damage, which is the role of CPR. This is a sequence of procedures, as I have already told you, which is performed to restore circulation of oxygenated blood after sudden pulmonary or cardiac arrest. Chest compressions and pulmonary ventilation can be performed by anyone, anywhere, and without any equipment, which we will be demonstrating later on.
I'm Dr. Faisal, and today we're recording a demonstration about basic life support with Ishfaq, who will be helping us with this demonstration. So the first step of the basic life support starts when we find a patient who is unconscious and unresponsive. The first step in basic life support is to check for your own safety, because we do not want 2 casualties. The first is the patient, and then the second might be you. So first look that you are safe yourself, and then go to help the patient. The second step is to look for the safety of the patient. So if a patient is in a car, you turn off the ignition, you look for any oil leaks, and if there is any fire or any such danger, you pull the patient away from that danger. And another thing while you do that is to look at the spine, at the cervical spine, at the neck of the patient. Because one of the major causes of morbidity in patients is that we do not take care of their spines. Sometimes the neck is broken, and when you move the patients haphazardly, their spine becomes more damaged. After that, after the patient and you are out of danger, then you have to start with BLS, basic life support. The first step is to look for responsiveness of the patient. So if you find a patient who is not conscious, so you go to the patient, you hold his shoulders, gently shake the patient, maybe give a painful stimulus, maybe pinch the patient, maybe rub your knuckles on his chest, and call out, shout out to him, "Are you okay? Tum theek ho? Aapko koi problem mat hai?" If the patient responds, then you don't have to do anything, because his circulation is maintained and his breathing is maintained. But if the patient is still unconscious, then you have to check for his circulation and you have to check for his breathing. For circulation, you go to the carotid arteries. Carotid artery is the artery of the neck. This is the last artery to go. So it is between the muscles of the neck and your trachea. You put your hands gently over there and you can feel the pulsation. So you go to the patient and gently feel. Do not press too much. Gently feel for the pulsation. If the pulsation is there, the heart is working. If the pulsation is not there, the heart has stopped. That's called the cardiac arrest. Then you have to go near the head of the patient, put your ear near the nose of the patient, hear for the breathing, feel for the breathing on your ears, and look at the chest for its rise and fall. If there is no rise and fall, you cannot feel him breathing and you cannot listen to him breathing, then he is in respiratory rest or his breathing has stopped. After that, the first step according to ABC is A, airway. So you have to open the mouth and look for any foreign body inside the mouth. Sometimes when the person is unconscious, his tongue falls back. So if his tongue has fallen back, so you put your finger inside and you sweep it out of the way. After that, to open the airway, if you've seen nothing inside the mouth, don't do a finger sweep. If the airway is clear, then you have to open the airway. For that, you put your hands behind the mandibles, behind the jaws, and gently lift it up. For a patient who is conscious, it is a painful maneuver. So don't do it in a conscious patient. If the patient is unconscious, just lift it and open the airway. After that, for breathing, the normally recommended procedure is that you give 2 breaths after every 30 chest compressions. But the newer recommendations are that you don't need to give mouth-to-mouth respirations. Your chest compression is adequate to give both the circulation as well as breathing in this patient. So if you believe in the traditional methods and you have to give breathing, then you pinch the nose of the patient, open his mouth, put your mouth on that and give 2 breaths. After that, you have to give 30 chest compressions. So how you give 30 chest compressions is like this. You put your hand on the chest bone, the bone in the middle of the chest, put another hand over it, lock both hands. You don't have to push in. You have to put your weight over it. You have to stand up, lock your elbows, lock your shoulders, and put your weight over the chest. Don't do it in a conscious patient because it will hurt him badly and it can even damage him. In an unconscious patient, put your hands over his chest, lock your elbows and shoulders, and put your weight. And with your weight, press his chest till it goes 2 to 3 inches inside, or it goes 1/3 of the chest breath. So this is the chest breath, it should go 1/3 of it. Give a push inside, then leave it, and let the heart refill. So you don't have to just push in and keep the hands down. You have to let the chest relax. So you give it in a ratio of 30:20. You give 30 chest compressions, after that 2 breaths. And if you don't believe that in the giving mouth-to-mouth respiration, then you have to give 100 chest compressions per minute. So one way to do that is to do 1, 1,000, 2, 1,000, 3, 1,000. Put a word in between your numbers to give a gap. So like I do it 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. So that's it.